Good afternoon. On Monday I will present the data of the FORTE trial, which is a randomized trial for newly diagnosed myeloma patients that evaluates two different carfilzomib-based combinations as pre-transplant induction. The combination of carfilzomib plus lenalidomide and dexamethasone versus the combination of carfilzomib plus cyclophosphamide and dexamethasone. The results I will present are based on the induction phase of the trial and are mainly response and MRD data, since the follow-up of the trial is still short. What we saw was that both regimens were highly effective, with about 90% of patients that achieved at least a partial response in both treatment arms. KRD, however, was more effective of the two regimens, because we saw a significant increase of the rate of very good partial response, around 70–75% versus 60% with KCD. And we also see a significant increase in the rate of near CR and CR with KRD versus KCD. Also, we were able to evaluate MRD in a subset of patients, and we saw a significant increase in the MRD negativity by second-generation flow cytometry with KRD versus KCD. It is of importance that this high efficacy of both regimens, higher with KRD, however, was noticed in all the subgroup of patients analyzed, so it was true for standard risk patients, but also for the high-risk patients that represent currently an unmet medical need. These together with a safety profile that was manageable. So I think these results are promising, and these two regimens, and in particular the KRD regimen, should be addressed in the future as should be used probably as one of the options for newly diagnosed patients. Of course, these results are preliminary, and before using the drug outside of trial, we need to evaluate also the survival data that, however, are not mature because the follow-up is still short.